Hey guys, it's Matt Harkness with Your Medical Practice Mentor. I thought I'd kind of show you one of our pelvic floor rooms before we get started today. Direct access to a bathroom, which always the pelvic floor team, which includes my wife, loves. So it's really great to have this specifically designed room just for pelvic floor. Well, today is an exciting day. We are getting ready for our annual Leadership Summit that's going to be happening tomorrow, and we're going to lay out the strategy for our practice over the next 2 quarters. And I have a special guest, one of my clients, Michael Karaginas of Freedom Physical Therapy, is going to be here, and he is going to be hosting craniofacial class this Saturday and Sunday, and it is packed full of students, so we're very excited. So this is part 2 of incentive compensation. This is always kind of a tough subject, but it is important that we discuss. So last week we looked at what I call the cascading schedule, how to prioritize your schedule. Now, I talked at the end of that post last week that you need certain tools to make the cascading schedule and the incentive compensation work well. So there are essentially 4 tools that you need to have a successful incentive compensation model. So the first tool you need is what I call the master charge sheet. And basically this is a Google Sheets. It's a spreadsheet where we include everything in terms of insurances, CPT codes that are allowed, and how much they pay for each CPT code. And under each insurance, we list the codes from highest paying to lowest paying. And we put any, like how many CPT codes does the insurance allow, are there any restrictions, time requirements, all the information is there so that the team can confidently bill optimally and compliantly. And of course, on a Google Sheets, we can update that form regularly so it's very accurate. We do a printout, we put it in the staff room as well. The second tool you need is a unit tracking tool for each clinician. Again, this is a spreadsheet, and it has listed on there the required target units for that individual clinician. It has how many units they got in a day. It also has if they sold any products, because they do get 20% commission on the products. And it also has any administrative hours that they did, so we can have those. And just a pro tip, I encourage you to do payroll weekly instead of bi-weekly or twice a month, because you can manage your cash flow better. And this unit tracking tool goes to HR because they have to process the payroll, calculate all the units, and make sure that it matches the insurance. So really important tool there, the unit tracking tool. And another pro tip about having this is that the leader or the manager of the team can see if they're dipping below their target rate. They can, quickly have a proactive meeting and kind of discuss, maybe they need to work on getting a better buy-in and commitment from the patient to make sure they attend all their sessions. Maybe they need to work on efficiency in their documentation. Maybe they're over-documenting. So the third tool you need is a firm cancellation policy. We actually charge our patients a full price of the visit if they cancel. And our fee schedule, it is $200. So they do get charged $200 if they do not give us notice within 24 hours. Now, of course, we never want to charge this, so we give them ample opportunity by repeatedly, in a nice way, but saying, this is our cancellation policy. Do you understand? Please sign this form. And if something comes up, their car breaks down, or they can't leave the house, they can do a telehealth visit. And we explain that's a great option for them. And sometimes it's nice to see them in their own environment. We can give them better advice, and it's very valuable. So just also expect you will get some irate patients, and you will lose some, but that is the nature of being a bit more firm with your cancellation policy. And it's good in a unit pay structure to have this, because if someone cancels, you can't fill the slot, and you have the cancellation fee, the clinician is still going to get credited their units, so they're still going to get paid. So that is really important. The last item, maybe the most important, is a formal compliance program, and this is super important. You know, we want to make sure that we're complying with all the regulations, and we're having regular training. We're doing some periodic chart audits. We use Nancy Beckley's Nancy Beckley and Associates. They have a great program, and you subscribe, pay a monthly fee, and they offer a very robust compliance program that's all built out for you. Last but not least, we have a favorite expression here. We call it wet cement, meaning, remember, logistically you might get some challenging comments from your team. Well, how's this going to work? But remember, say this is wet cement. You know, we may have to adjust the unit tracking tool. We may have to kind of, look at the cancellation policy, and maybe we'll learn some things, how to approach it a little bit better. But at any rate, these are the great tools you need, and they have worked well for us. And it actually creates a sense of a higher value of what we do as doctors, and also with the patients. So, all right, guys, I'll have part 3 next week, and I look forward to seeing you.